Hey guys, I'm Kim, and today I'm going to be talking to you about the cause of the sudden cardiac death. And sorry about the please change the lamp, that's going to be there the entire presentation. Alright, so my objectives for you today are to help you understand what long QT syndrome is and to understand what's causing this disease, and then some ways that we can go about treating and help prevent the syndrome. So first I want to talk about what is long QT syndrome. Long QT syndrome is a chronic heart disease. It's an irregularity of the heartbeat, so it's most of the time a fast chronic heartbeat, and because of this it can cause fainting, seizures, and in some cases sudden death. Most of the time this is brought about like when you have exercise, vigorous exercise, or in a stressful situation. So most of the people that have this long QT syndrome are born with it, so it's a genetic defect in which they have faulty or they're lacking potassium or sodium ion channels to the heart. If they're lacking potassium ion channels, it's mostly active when they have vigorous exercise, and it causes a really fast heartbeat, and because of this the blood can't get pumped to the heart, and it can be fatal unless it's treated promptly. And if they have faulty or they're lacking sodium ion channels, then it is caused when their heartbeat is beating at a slower than normal pace. And this is caused when they're sleeping, and most of the time this is fatal. Not only can you get it by being born with it, but you can also get it through certain medications. They have found over 50 medications that cause this long QT syndrome. Some of them include antibiotics, antidepressants, heart medication, which seems kind of ironic, cholesterol-lowering drugs, diabetes medicine, and even some antifungal drugs have all been shown to cause this long QT syndrome. This is just like a chart of some drugs that are associated with this syndrome, and it goes a little bit more in detail than what I had said. So most of the time we see this in athletes, and the number one cause of death for athletes are these sudden cardiac deaths, and that can also include like heart attacks, but the leading cause is the sudden long QT syndrome. They can diagnose it, but it's not normally done in checkups. You have to specifically ask for it to be done, and because they'll like follow your heartbeat throughout a period of time to see if it's elongated or not. So some athletes that have it, this is an example, Dana Vollmer. She is a professional swimmer, and she had dizzy spells, so she went to the doctor to get it checked out, and they diagnosed her with this syndrome. And her family and her decided that they didn't want to get the defibrillator in her heart, which would have been like a career-ending move. So instead, they decided to have her continue with her career of swimming despite this disease. And I guess it paid off for her because the next year she won her first gold in the Olympics. And I did some additional research on her and just read some articles, and she said how terrifying this experience was for her because she had to do a lot of underwater swimming, so she would have to hold her breath a long time, and that would cause her heart rate to increase, and she would have a lot of lightheadedness and feelings of being dizzy, and she would always associate it back to this disease. And she never knew if she was going to go into cardiac arrest or not, so she would always have to have an external defibrillator on hand by the pool, ready just in case something bad did go wrong. Now, not all the time there's a success story. For example, Mark Bowe, he was a professional soccer player, and he actually collapsed and died during one of his games. He had an autopsy done afterwards, and they found that he was diagnosed with this long QT syndrome. And it's not uncommon for athletes not to know that they have this disease because, like I said, it's not normally checked on. And so when they participate in this vigorous activity, it causes their heart rate to go up, so they'll just collapse during the game or whatever. Another athlete was Reggie Lewis. He played for the Celtics, and he collapsed during one of his games and was rushed to the hospital, and the doctor that he was seeing said that he had a heart disorder, but he kind of played it off and went to a different doctor to see if this was actually true. And that doctor unfortunately said that there was nothing wrong with his heart, like he was fine, he could go back to playing. So he did, and during one of his practices, he was just shooting hoops with one of his trainers, and he unfortunately collapsed, and he passed away and died because of this, and it's later found that he did have this long QT syndrome. So again, he was told the risk, but he continued to play anyway. So there are some ways that we can help treat and prevent this long QT syndrome. There's different medications you can take to help lower your heart rate. You can also have surgery, but most of the time this is for the people who are at high risk of having this cardiac disease or deaths, or they can't take medication, or they have an implant. And you can also, some simpler things you can do are some lifestyle changes. So don't participate in vigorous activities, reduce the loud noises, and just stay away from places that cause strong emotion or are very stressful for you. Just inform others around you. So let your family and friends know that you have this disorder, so that they know not to throw any surprise parties for you that will cause your heart rate to go up. Control startling events. Know your symptoms, so know what events make your heart rate go up, so you know to stay away from them. Don't overexert yourself, and also have a plan for an emergency situation. You never want to be caught in the dark where you don't have a defibrillator on hand. So make sure you always know what to do if something does go wrong. Those are just my resources. Anybody have any questions? Yeah.
You might have said it, but how common is long QT syndrome?
It's more common than we think. They just don't diagnose it that much, but it is pretty common, and, especially among athletes because they're doing these vigorous activities.
It's scary.
Mm-hmm. Yeah.
Do you know what the QT stands for?
I'm not sure. I don't know. It was just every place that I went to, it was just long QT. It never said if it actually meant anything, or if it was just always QT. Yeah. I never found anything that would explain what it was, because I was wondering that too. Anything else? Okay, thank you.